I'm Amanda Woerman, an assistant professor here at UCSF. I study a number of neurodegenerative diseases, including multiple system atrophy and chronic traumatic encephalopathy. When I was a graduate student, I was hunched over a microscope all day. I was in a lot of pain with my back. I had just started training for my first marathon and thought I could power through it. It was nothing. I did not get the best medical attention at that time and spent about 6 years in and out of physical therapy trying to manage all of the symptoms associated with a herniated disc. When my back became so severe that I could barely walk to the bathroom from my office, I had pain running down my leg, I had a lot of weakness, and it was at that moment that I turned to one of my colleagues.
My name is Aaron Clark, and I'm a neurosurgeon here at UCSF, and I work at the Spine Center. When I first met Amanda, I reviewed the MRI scan, and what jumped out at me was an acute herniated disc which was compressing the L5 nerve, and I felt she was, in particular, a great candidate for a minimally invasive spinal operation. One of the best things about minimally invasive spine surgery is that it involves a less invasive exposure to the spine. And once you get that exposure of the spine, it's actually the same great operation that's worked for decades and decades. Actually, any patient that has a spine problem could be a candidate for minimally invasive spine surgery.
When I woke up from the surgery, I instantly knew things were going to be better. I could immediately tell that all of the pain in my leg was gone.
I love being a spine surgeon because I have the ability to treat patients with complex problems and really, in some cases, give them their life back, doing it minimally invasively, preserving their muscle, involving less blood loss, and also significantly less pain.
Being back at work is so much easier to do my job. Just standing for 30 minutes to an hour was incredibly painful. Now I can give an hour-long seminar and I don't have to worry about it at all. And that's been an incredible relief.
Working with Amanda was amazing because she was able to so quickly recover function of her foot, which allowed her to return to all the activities that she was so passionate about, even competing in an actual IRONMAN event within a couple months after surgery.
A lot of physicians see the need to get patients back to just a normal standard of care. But when it comes to an athlete, it's not just, can I take care of myself on a daily basis? It's, can I go out and run? Can I get on my bike? And so one of the things I really value about Dr. Clark was it wasn't just enough to say, can you walk again? But can you run? Can you do this Ironman? About 6 weeks before the race, I was allowed to start running again. If I could do 2 hours and get that amount of time on my feet, I would be in good shape going into Arizona. Ironman Arizona was one of the most amazing experiences of my life. I knew that there was a good chance I could end up in a really dark place mentally while I was out on the race course, and also knew that everything I had experienced leading up to race day was going to provide me with the strength that I needed to fight through it. As I started to come around the final turn, that I really started to let everything sink in.
Amanda Woerman, you're an Ironman, Amanda.
It was a lot of excitement, of course, and a lot of relief and just gratitude for every opportunity that I'd had and the access to the surgery, to Dr. Clark, to the ability to finally feel pain-free. It had been 6 years of living with the pain and racing with the pain, and to actually do a triathlon where every part of my body except for my back hurt actually made me really happy.